afternoon. It is 2:30. Welcome to CCDPH Schools and COVID-19 Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department in the Community Engagement and Health Education Unit. Let's get started. Thank you for taking the time out of your busy schedules to meet with us. As usual, our objectives are to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide CCDPH's contact information and resources. Few announcements. At the beginning of the year, we changed to a bi-weekly format. We felt that the mitigations were leveling off, so we decided to do a bi-weekly format. If we feel the need to go back to weekly, we will make sure we let you know. Our webinars are recorded and they are uploaded to CCDPH's YouTube page as well as our website. We begin promptly at 2:30. Please keep your line muted. The chat will be disabled until Q&A in order not to distract from the presentation. Please confirm that the email address that you register with is correct. I get quite a few emails returned undeliverable. We want to make sure that everyone gets those resources and slides when I send them out. Here is CCDPH's contact information if you need it. If you need to ask questions to our general email, this is the ccdph.covid19@cookcountyhhs.org. If you'd like to report line lists, report communicable diseases, or have metrics questions, you can report to ccdph_schools@cookcountyhhs.org. And here is our website for various information. If you are interested in EpiPen requests for your school, please send them to me, kjones1@cookcountyhhs.org. Requests must come from a medical professional or a professional who has been trained on the administration of medication. Please type your requests. We do not provide the actual EpiPen. Our doctor will sign a standing order and a prescription, and it is up to the school's administration to fill them. I do sometimes pass on the resource EpiPen for Schools, where you can get your EpiPens. I have heard from various school nurses that either their website is down or there's something going on and they're unable to fill requests from them. Unfortunately, that is the only resource I have, so I would reach out to your school administration to see how you can pay for those EpiPens. If you haven't heard, you can get 4 free COVID tests sent to you by the U.S. government. You can go to covidtest.gov to request those. Or you could also go into your various pharmacy and you could either have them run your prescription, your insurance and bill your insurance, or bill your insurance and get reimbursed for those Binax home tests. If your school is interested in the rapid antigen test kit, you can find that information on the website. If you have any concerns about testing sites, you can report to the Attorney General's office at the phone number below. If you would like to set up shield testing for your organization, feel free to email IDPH at dph.antigentesting@illinois.gov to make your request. Just a few resources that we have coming up. We are co-partnering with Mayor Tiffany Hendren of Dalton to have a free blood pressure screening. That is that's Sunday. Blood pressure screenings, COVID testing, and other resources at Thorn Ridge High School. This is the vaccination event that was rescheduled a few weeks ago through that first snowstorm we had. It's rescheduled for this coming Wednesday, 12 to 4. Oak Forest Health Center will be open starting next week for 1 month for drive-through nasal testing and vaccinations. All of the information on the days and the hours is on the flyer. And here's all of our Cook County Health clinics that you may go to get your child or yourself vaccinated if necessary. All of our mass vaccination sites that we opened last month due to the surge and the increase in positive cases have now been closed. So you can refer back to those individual clinics if you'd like to get vaccinated at CCDPH locations. I'm sorry, there is a fire truck passing by. If you'd like to find out any information about any events that are going on within the community, you can go to our Cook County Health Department calendar. This is just a screenshot of the things that we have coming on in the next couple days, but you can look and you can find out more information about events that are upcoming. This is just mental health resources I wanted to share. NAMI of South Suburban Chicago is offering a free mental health program. If you know someone who is in need or a family that's afflicted, you can sign up for that. And then that flyer will be attached to your slides when I send them out. And we make sure that we mute all of our lines. Michelle, can you mute that for me, please? I appreciate it. If you would like to have a school clinic at your school, you can contact the following people in order to set that up. If you'd like to host a vaccination clinic but need to know a little bit on how you can get that started and some resources and best tips, you can go to our website for the mobile community playbook on how to host your vaccine event. Here's other educational resources you may download and use at your school or facility, and information about our My Shot YouTube campaign by people in the community who've been vaccinated. They're just telling their story. If you'd like to have a speaker come to your school or event, you can submit that Google Doc and answer a few questions. They'll ask you a few questions about your event to try to match you up with the best speaker for your event. We are still offering free rides to vaccinations. You can call the 833-308-1988 number to offer rides for your vaccinations. If you cannot leave your home and you need an in-home vaccination, you can call this number or go to the website to request an in-home vaccination. Also, people who live within the home of the person who is homebound can get vaccinated at the time as well. So it'll ask you questions about who all needs to get vaccinated. Thank you for that. I'm going to stop sharing and I'm going to pull up Dr. Rubin's slides. While I am pulling up the slides, I want to welcome Dr. Rachel Rubin, who is our CCDPH co-lead and medical director. Thank you for taking the time out of your day, Dr. Rubin, to meet with us to talk about the masking information.
Appreciate it. And thank you all for joining today. And I'm glad that I could be with you today. And I especially wanted to address the group today because of all of the confusion and difficulties around the mitigation orders by the state and what are we doing here in Cook County. So a little bit of the background, people understand that last fall there was a series of executive orders that required a variety of things: face masks in schools, vaccination and regular testing of school staff, and also the ideas of what's understood by quarantine and isolation of students under the assumption that a child that tests positive or is a close contact shouldn't be in school for a period of time. So these are under a series of executive orders. And in fact, we in Cook County, suburban Cook County, with our health department, put in a masking order even before the state did, and that was in last summer in August, I think it was. So that's those were executive orders. But in addition, just a couple of months ago, actually, it's the governor issued a set of emergency rules with IDPH to implement these executive orders. Because here you have the executive orders, but there needs to be in place a mechanism for enforcement, a mechanism for implementation of these rules. So that provides sort of standard operating procedures or some at least strong guidance about how to go ahead and put in place these orders. And so that went in place about, I think, 2 to 3 months ago. And as a consequence of those emergency rules, that then ceded to the Illinois State Board of Education the ability to enforce, to promulgate guidance, these rules, as well as actually enforce them. A series of lawsuits was filed by various parents on behalf of their students. And these lawsuits were then eventually put together into one lawsuit. And that included about 170 school districts across the state with, I think, somewhere over maybe 400 some students. I don't remember the exact amount of students, but it included students that went to about 170 different school districts across the state that were challenging the mitigation mandates, specifically masking, but a variety of things. And so These cases were consolidated and assigned to a Sangamon County court, and the judge there in Springfield granted what was called a temporary restraining order that blocked enforcement of these mandates until the case was decided on its merits. And in that court decision, at least the state, the Attorney General of the state of Illinois, as well as our local council here in Cook County, the state's attorneys as well, they have interpreted this TRO to only refer to the students that were named, or the families, the parents with students that go to these 170 school districts. So it didn't mean that these 170 school districts could then go to mask optional if they so chose to do so. It was actually referring only to those groups of that group of students that were specifically named in the lawsuit, because the one thing that the judge did is the judge did not uphold this sort of consolidation where they were calling themselves a class, meaning that they were representing all students in all schools throughout Illinois. They were saying that the judge said it only referred to the students that were named plaintiffs in the suit. So it says that decision, not the restraining order, but this suit itself is now an appeal before the 4th District Court of Appeals. There also was an appeal put in place to remove the restraining order. So let's go to the next slide. So we'll get back to that because yeah, we're here. All right. So on Monday of this week, IDPH wanted to reissue an emergency rule for schools on masking, because when it's an emergency rule, not an executive order, but when it's an emergency rule, it expires. I think it's either 60 days or 90 days. I want to say it's 60 days because I have some thought it went in place in December. But in any case, the emergency rule would have to be reissued for it to continue. And JCAR, which is the Joint Committee on Administrative Rules, which is a bipartisan committee of the Illinois State Legislature, voted to not approve the reissuance of these rules because this TRO and appeal of both the original emergency rule as well as this executive order are both part of this suit. And so they're saying, we don't want to reissue the emergency rules now. We want to see what's the ultimate outcome of the suit before we do that. So what that means is that the emergency rules are no longer in place, which means there's no real enforcement mechanism for masking mandates and other rules within schools. But the executive order is still in place. You know, so the governor's order that went in place in September is still indeed in place. And so, however, because the emergency rules are no longer in place, we don't really have those rules that are binding that then allow ISP to provide some level of oversight and enforcement of the masking rules. So next slide. The appeal was decided in the early hours of this morning or very late last night, and they dismissed the appeal of the TRO, of the temporary restraining order. But what they did make a point of saying is that individual school districts are not restrained in any way from making their own rules about masking. They don't have to go to voluntary masking. School districts, such as the City of Chicago School District, and that is a little different because it's also part of their bargaining agreement with the teachers union, but nonetheless, a school district can still say, we are going to maintain masking and make it mandatory. Or they can go ahead and make it voluntary. And that is up to each school district to determine their own approach to this. They are no longer required to be masking, to require masking of all of their students, staff, and faculty in their schools. That being said, and that's because there is no enforcement, even though the executive order itself is still in place, which does cover schools because it covers everybody about masking indoors. And that particular rule actually, executive order, the overall executive order that went in place September, actually expires the first week of March. So just a few days after the governor's deadline of February 28th, of where he's saying that he hopes to be able to lift the indoor masking mandate. But he says that he still wants to maintain it for schools, transportation, as well as medical facilities, including hospitals, clinics, and long-term care facilities, as well, nursing homes. So we will see what happens at the end of the month, and we are hoping that our metrics will continue to improve enough that we would want to be consistent with the governor's order and not have something remain more stringent in our county, because right now we have a masking and vaccine proof mandate in place for suburban Cook County, minus the suburbs that are not in our jurisdiction. So we are hoping to go along with the governor in terms of lifting indoor masking, but we do agree with him and still want to maintain this in schools. But at this point, things are going to be voluntary because there's no ability to enforce an indoor masking in schools at this point. Next slide. Yeah, I think this might be the last one. So I've already been talking about the interpretation. So we're saying that the TRO ruling applies only to named plaintiffs and the districts named in the lawsuit, so these individual students. But as I had said, the executive order doesn't have teeth to it anymore because that's what the rules provided, and the rules have expired and they were not renewed. So we then in the health department are still very, very strongly pushing for masking in schools to remain as one of our key components of what's called layered mitigation, which is laid out very well by the Illinois State Board of Education guidance for schools. So that includes anything from the masking to the physical distancing, improved, better ventilation in schools, and continued hand washing. And this is for indoor activities. And then there's also testing guidance, especially for sports, indoor sports versus outdoor sports. And so this is what's called a layered approach, or I like to say a tiered approach, but a layered mitigation approach. And masking is integral to it. And of course, the bottom line is vaccination. And the single largest decade or group of people that are not vaccinated are our young people, those under the age of 20, and especially those under the age of 12. And as you know, there's been a delay in approving the vaccination for people, for our little ones between 6 months and through 4 years old. And that probably won't come online until sometime in April. The FDA is waiting for more data to come in about the need for possibly, for the need for a booster for 2 to 5 year olds specifically. So in the setting of not having most of our children vaccinated, it's maybe 35% of our people under the age of 12 are vaccinated. So in the setting of low vaccination rates, we still are pushing for masking as well as this layered approach to mitigation in schools to be maintained. And that also includes, test to stay, and as well as the isolation and quarantine guidance. Next slide. I think that might be it. Yeah. Okay. A couple more. Right. So this is ESP guidance. You can go to it online. There are some exceptions to the masking rule. It's only for children 2 years old and older. And if somebody cannot wear a mask because of a certain kind of disability or problem, medical issue with wearing a mask, then that is understood, and a reasonable accommodation should be made for that individual. because the bottom line is to try to provide as risk-free a workplace and a learning place as is possible. Next slide. Okay, and then this is the last one, and this is again in the small print. This is our statement on COVID mandates, and we are putting out a revised one today that reiterates this statement that it tells you what our jurisdiction is, and it says that these are the things that we are looking for in order to be able to go along with the state, hopefully on February 28th, is that we are looking at metrics that include sustained improvement in hospitalizations and ICU beds availability. So we are looking at how many individuals have been admitted or are currently admitted for COVID and how many of those are in ICU. And those numbers are continuing to drop precipitously, which is wonderful. And that's really the most important thing because our case rates are still very high. Because remember, we started at such a high peak that even though our case numbers have come way down, we're still seeing maybe 400 new cases a day diagnosed of COVID. And that still puts us in this high category by the CDC guidance guidelines or risk community risk levels that they lay out. But we are continuing to come down, and we hope that we will continue to come down and not level out at a somewhat higher level than we would like to see. What that means is as we know, Omicron is less serious. It tends to cause people less serious illness, and especially because our vaccination rates have gone up amongst adults, is that adults are getting less sick from COVID. So that's why our hospitalization rates are really going down. But we know with all of the home kits there that we can't even really know exactly what our case rates are. We know that there are many more cases out there than are being reported because the at-home kits are not being reported. But we also don't know how many negatives are out there too. A lot of people are using their test kits at home on a regular basis, and there's no way to report a negative. In fact, I have several sitting right here in front of me in my house, right? When my college daughter came home and she was out a little bit seeing friends, she wasn't just hunkered down like my husband and I were at home. She was going back to school, and she went on a little trip and came back home before she went back to school. Believe me, she was using these all the time, as were the rest of us. But it doesn't mean, and they were all negative, but it doesn't mean we're reporting the negatives anymore. So we don't know that denominator. We don't have a clear sense of the numerator for looking at either our case rates or our test positivity rates. We have a general idea, and the idea is to look at trends then, not absolute numbers necessarily, but to look at trends. And we are seeing decreasing case rates, and we want to try to see them to a moderate level. And this is based obviously on the PCR tests, because those are the ones that get reported predominantly. And our goal is to get between 10 to 50 cases. Right now, we are maybe about, I calculated it the other day, I think we might still be over 100 per 100,000 population. Okay, but we want to get closer to 50. But our test positivity rate is way down. It's 3 now. So it is in a low category. It's not even in a moderate level. It's even better than that, our case positivity. But like I said, we don't really know how many cases there are really around out there that are either asymptomatic or mildly symptomatic, and people aren't testing themselves as much anymore, or they're testing positive and not saying anything about it. So bottom line, we are still supporting very strong mitigation efforts, especially in schools. And we still would be supporting universal masking for indoor public places, at least for the time being, until we see how things are by the end of the month. But even at that point, we are likely to continue to recommend strongly that schools maintain masking as well as this other layered mitigation procedures in schools. Okay, and I do think this is the last one now, Kelly. Yeah.
I'm sorry, did I stop sharing prematurely? Was that your last
No, it's
slide?
good. That was it.
Okay, I'm sorry about that. Let me open the chat if there are any questions. I'm going to ask that you limit your questions to Dr. Rubin regarding masking. If there are any mitigation questions or things for Lex or Michelle, to just hold on for a second and then they will get to that. Ms. Dr. Rubin is limited on time. I appreciate that. The chat is open. If there are any questions for Dr. Rubin, we'll be glad to relay them her way. Thank you, Dr. Rubin, for taking the time. There's such a lot going on this week as far as masking. You miss one day and you miss a lot. There's a question coming in from Kevin. Uh-oh. What should TTS look like for mask optional schools?
Very good question. I think at this point, test to stay means that there has to be masking. So what test to stay means is that if you're testing, if you're a close contact and you've been vaccinated and you're staying in school, you've got to wear a mask that entire time. So you've got to wear a mask during that period of time that you're being tested, on a daily basis. Every other day, day 1, 3, 5, whatever it is. Yep.
Thank you. Next question. There's a thank you in the chat. You stated that you feel that CCDPH would go with strongly recommending at the end of the month. Please confirm.
At this point, we are thinking that we are going to continue to recommend masking in schools at the end of the month. And we will see what the governor does in terms of putting that, as part of an executive order that may have some rules to it that allow that to be enforced, But at the very minimum, we are going to continue to recommend that masking may be maintained in schools.
Thank you. Next question. How does optional masking fit into the 5-day isolation and quarantine guideline?
You have to be wearing a mask. So if you do 5 days of isolation at home, when you come back to school for that second 5 days, no symptoms, you're feeling great, you have to wear a mask for that second 5 days or you cannot be in school.
Are there any changes with COVID symptoms and sending kids home?
No. No change to that.
Do we have an updated decision tree for K through 12 schools? Do we still need to exclude any symptoms, or should we do an H&P and consider exposure, vaccination status, etc.?
Those decision trees were, I think, put up by the Illinois State Board of Education. Under what's consistent with the CDC and the Illinois Department of Public Health. We don't do that. When you're saying doing an H&P, it means you've got to be seen by a medical provider. And at this point, what we want is that if people are testing positive, communicate with your doctor, but you don't necessarily have to go in if you have an asymptomatic or very mild case. The important thing is to isolate yourself.
Right. If schools make masking optional, do people have to wear masks when they are in the healthcare office? That's part one of that question.
Yes.
Second part, if students' parents do not want them to wear masks, are schools legally allowed to ask students to put masks on?
You may certainly ask them to put a mask on. One thing that is certainly possible and that would help protect you is that any school or school district can set up their own guidelines and rules. And if they say we are going to remain mask required as opposed to mask optional, they are allowed to do that.
Okay, here's a private question that came in. Why is the serious risk of COVID to all of us, some of whom have serious health issues, outweighed by the minor inconvenience of wearing masks in the eyes of the parents in the court? It sounds like they're asking why are masks being eliminated when there are people who have serious health issues? Why is that not being a consideration?
Well, it's not, yeah, that's why we're saying that we want masks to remain in schools from our local health department. Oh, one other thing too, before I go on with that, Lex put in there something that certainly needs to be emphasized is that if you're a close contact of somebody as part of this test to stay, if you're a close contact of somebody and you're unvaccinated, you have to quarantine. It's only if you're vaccinated. And I didn't emphasize that. Okay. But to go back to that question, to the question you're saying is that there is an enormous amount of COVID fatigue out there, and many families and individuals throughout the country are pushing back quite vociferously against masking. And so then the powers that be are beginning to, as cases are going down and as community spread is decreasing, state governments are beginning to issue lifting their masking orders for those places that have had them. Do I think that's good public health practice at this point? No, I don't. I think that we should be maintaining masking indoors. Exactly for the reason you said, it's to protect the most vulnerable in our communities. So I'm going to continue to wear a mask when I go into a grocery store, not only to protect myself, but to protect others that might be there, that are older, have underlying medical conditions that put them at higher risk of complications from COVID, or where the vaccines don't work as well in them because of a medication or a type of condition they have. So that's why with young people where they are not vaccinated, where our 15-year-olds and our 12-year-olds and our 10-year-olds are not vaccinated, and then our littlest ones who are not allowed to be vaccinated yet. When that's the largest group of unvaccinated people, they may not get very sick, but they're going to bring it home to their elderly grandparent who doesn't have the same level of protection or ability to fight off the infection that the child might.
Thank you for that. There was a person who missed the answer to masking in health offices. Is that still
Yes.
permitted?
Yep.
Yes.
Yep. All healthcare facilities, and that's actually based on federal guidelines and related to Medicare and Medicaid reimbursement, is that healthcare facilities need to continue to maintain masking in their facilities of everybody.
Thank you. Lex answered a few questions in the chat. Next question, if a student or staff refuses to wear a mask, even if the district is required, what are ways that we can enforce it?
That would be up to your district and would have to be working with your local municipality.
Okay. I think Lex answered the next question. Is a health office in a school considered a healthcare facility?
That's a good question. I would say yes, because if a child is going to go in to see the school nurse because they've got a sniffle, it could be COVID. If they go in because they, got a cut on their finger, if somebody right ahead of them had come in with cold symptoms, either way, I would say that yes, you should be masked in that area of the school.
Was just a statement as a dedicated school nurse who's gone above and beyond to keep our students and staff safe. How do I not feel frustrated or even angry at parents and students who gleefully and blatantly stop masking? I understand your frustration.
We all share that feeling.
Yes, we do. I believe those are all the questions. If there are any more questions for Dr. Rubin, now is the time to put them in the chat. Dr. Rubin, we want to thank you so much for taking your time to clear us up on all of the mask confusion. It's been a lot of confusion back and forth. There is one other question that just popped up. Expiration of the rules also eliminated the exclusion of asymptomatic individuals, even if not masking without a health department order. Is that correct?
Only if the individual refuses to leave. If the individual child, it's usually like a close contact, of a case. If they refuse to, if the parents refuse to take the child out of school, then we absolutely can issue a quarantine order. Or if it's a positive but asymptomatic case, absolutely we would issue an isolation order. Yes.
So I will allow, oh wait, it just popped up. Band students and slitted masks. Can students be required to wear 2 slitted masks during band?
Yeah, I don't know the band guidance, music guidance. I'd have to look that up. I think that if they're allowed to use slitted masks now in band, that wouldn't change. But if they're not allowed to wear slitted masks, then I would say no.
I believe Michelle sent that person the link to the IDPH guidance earlier today. I remember seeing that email.
Okay.
Clarifying that after quarantine or isolation, 5 days, all must mask for 5 more days.
Yes.
Yes.
Let's all master 5 more days.
Okay. I believe that is it for Dr. Rubin, and we will let Michelle and Lex continue with the chat when we finish. Thank you, Dr. Rubin. I know your schedule is very tight. Feel free to stay on if you like, but I know that you are very busy, and I will toss it to Lex, and she can start with her update. Thank you so much for your time.
So obviously, Dr. Rubin covered a lot of what I was even going to say before this went on. So this is just going to be a general metrics update, and then some kind of advice for where do we go from here with this masking situation and some rules in a sort of limbo. So we're going to talk about that, and then we actually didn't have any submitted questions. We've had a lot of questions that were just emailed to us directly, but not anything to be submitted for the group. All right. You guys know the drill with all this. As a reminder, please put very specifically what you're emailing us about when you email the school email, just since a bunch of us handle the email and we handle different parts. You guys have been pretty good about that. All right, so beginning with metrics for youth cases, if you need a point of reference, we are about where we were when we thought we had the scariest peak so far last winter, going from 2020 to 2021. So that's about the level we're at right now, and that seemed like a really scary number at the time, and it is, in fact, it's still very high transmission, but it's definitely trending downwards since we had that massive Omicron spike. So it's definitely getting better, but we are nowhere near where we were last summer when we were able to make masks optional in indoor spaces and, go back to having a small bit of normalcy in our lives. So it's still pretty high. We're at 134 weekly case rate per 100,000. And when I looked at the slides from the last time we spoke, this is nearly cut in half from where we were then, which is great, but it's still a very high level of community transmission. In terms of outbreaks, we're at around the same level as a state and the same level as a county, even though some outbreaks have ended and new ones have begun. So that's about where we are. The whole country is still in this orange zone of over 15 daily cases per 100,000, which, if you saw the previous slide, we were at over 130. It's kind of, that's daily. What we do is weekly. But that's still, as a point of reference, we've still got a ways to go. The travel guidance hasn't changed. For students, especially with spring break coming up, they can return immediately to school after traveling, whether that's domestic travel or international travel. But especially if they're unvaccinated, it's highly recommended that they get tested. For international plane travel, a lot of people will be required to test or prove that they've recently recovered from COVID in order to fly. But if you're going like a land crossing, like you're going to Niagara Falls or something, still get tested. But obviously there wouldn't be that international flight requirement. So that's the general recommendations. In general, stay away from cruises. Just kind of a disease trap in general. All right, and this is obviously the most important topic. Where do we go from here? So, as Dr. Rubin said, the public health recommendations that we've been working with have been informed by heavily researched science. We've done some of that research as a health department, as individuals. Otherwise, literally scientists around the world have gotten together to figure out what to do with COVID. All of our guidelines have been informed by what we've learned in the past 2 years about COVID. And these recommendations, they're not coming out of nowhere. They're really important, and these recommendations still stand, even if some of the enforcement measures have been pulled out from under us. So masking, oh, excuse me, sorry about that. Masking is effective. We have many studies showing that, KN95, N95's better, but any mask is better than no mask, and a comfortable mask that you're not going to be messing with all day is better than, any kind of uncomfortable mask that you'd be moving around and touching your face. So masks are effective. Masking should still be occurring in school. I know it's not easy for you guys to be enforcing that. Obviously, the best protection we have is the primary vaccine series and getting a booster. We've seen that if you have a natural infection, your immunity from that is about the equivalent of 1 dose of a 2-series vaccine, and it wanes after about 3 months. So it's important to follow up and get that 2nd dose in the primary series. It's important to get that booster. We're waiting on data from countries that have decided to do a 4th booster to see if that makes any difference. But being fully vaccinated with a booster shot is effective, like highly effective at preventing severe disease and hospitalization, and also very effective still in preventing any kind of symptomatic infection of any kind. So that's really important. These vaccines are approved. I can't remember what Moderna changed their vaccine's name to, but they have, there's official vaccine approval. It's not just emergency use authorization. So that's definitely the most important thing in this fight. Close contact definition hasn't changed. It's been informed by our studies of how droplets transmit the virus and how big the virus particles are. So close contact is still within 6 feet when unmasked for 15 minutes or more over a 24-hour period, and that's for people who are unvaccinated. So that still stands. Unvaccinated close contacts have to quarantine for at least 5 days at home, and then if they decide that they're able to wear a mask consistently for the latter 5 days, then they can return for those 5 days. Otherwise, that 10-day period has to be spent at home. Obviously, we want this to be a voluntary situation, but some school districts have interpreted the recent court rulings to mean that they can't exclude somebody without due process. I do not have a JD, I have an MPH, so I can't speak to the legality of that situation, but I do think that people understand, for the most part, the importance of quarantine. So hopefully voluntary in some cases, but if the situation seems unsafe, or this is a situation where the student or the family is not going to be compliant about staying home for the 5 days or masking for the 5 days after, we can issue a quarantine order. We had our first request this week. It came in on Wednesday. It was completely finalized and sent out on Thursday morning, and we have a hearing about it. Actually, the hearing started 14 minutes ago. So it's something we can help you out with. It is a process, and it includes a lot of back and forth, so it's something you have to be ready for. But if you feel like it's going to be an unsafe situation, we have your back. We are legally authorized to give those quarantine orders. That is part of our job. We do it for really scary diseases like TB, where it's really important that somebody quarantine or isolate. So that's something we've been doing for a long time. Cases have to isolate for the 5+5 days and wear a mask on the latter 5 days. I believe the Sangamon County judge said that isolation wasn't so much impacted by the ruling. Again, not a JD, but we can also issue an isolation order if that's needed as well. And I would say anytime someone who recently tested positive is a case and is refusing to stay home, that's an unsafe situation. We would be happy to help you with that situation. Most people, when they find out they're a case, they let their close contacts know, they stay home for a little bit. We've seen a lot of altruism in those situations, but if you come across a situation that's not going to work out, we will help you with that. For your reference, we have the exclusion guidelines we have for other diseases like chickenpox and measles and strep. Some diseases you have to be out for a long time because you're still infectious until your your pustules scab over in some diseases and things like that. And then I do want to remind everybody that as something that's completely not part of the emergency order, but is in the general communicable disease code, for schools in the general procedures, 690.20, this is the exact quote: persons suspected of being infected with a reportable infectious disease, which COVID is, it's reportable for it's supposed to be reported within 24 hours when you know about it, for which isolation is required, it is, or persons with diarrhea or vomiting believed to be infectious in nature, shall be refused admittance to the school or childcare facility while acute symptoms are present. We do this all the time. We did this before this, when norovirus is going around, when it wasn't just a lactose intolerant incident, so this is something we do on a regular basis. It's well established. This has been happening for a long time, and it's not part of the emergency order. So this is something that is still enforceable, and is jointly our jobs to be working on. All right. And as Dr. Rubin mentioned, failing to follow these recommendations means that a district or school is failing to follow expert public health guidance. This is what we do. Our only job is to make sure that the public is healthy and safe. We're trying to make recommendations that will keep children as a vulnerable population safe. So keep that in mind if there's a decision made to go against some of this guidance. If you're in a situation where masks are no longer required in your district, and I know that's really frustrating for some of you weren't included in the conversation for the district to go mask optional, there's still steps we can take to make it as safe of an environment as possible. Healthcare personnel, including you guys, school nurses, including the PT staff, including anybody who's there in a healthcare capacity, still needs to be masking with, the best mask that works for you, preferably an N95. I had a sinus infection, but otherwise, I haven't gotten a cold in ages. So think about all the colds you'll be avoiding, especially if masks are going optional. We are going to get hit hard with regular coronaviruses and other colds. Encourage masking to whatever extent the district is going to allow you to encourage masking. I know some districts have said you're just not allowed to talk about it, but some districts have said you should still encourage it. So encourage masking to the extent that you can. We still need to know who is a close contact and who is a case. So contact tracing, I'm sorry to say, for you guys who bear the burden of this work, is still very necessary within schools. We need to know when a close contact converts to a case. That's really important, and it's also our job and not impacted by the recent court decisions, to the best of my knowledge. It's still our job jointly as the health department and the schools to get control of outbreaks and clusters. And so contact tracing is still really important in those situations, especially on sports teams. We're going into more outdoor sports seasons, which is great. So hopefully we'll see a lot less, but we still will be needing contact tracing. So still be encouraging seating charts, setting up a classroom so that people are spaced as far apart as possible. As the weather gets warmer, work on that ventilation, open windows if a classroom has windows, things like that. Focus on classroom setup, lunchroom setup. There are still ways to maneuver things to make it safer, even if only like 30% of the student body is still masking. And as a reminder, IHSA sports and activity masking requirements still stand for competitions and performances. That hasn't been impacted. You're in sweaty, heavy breathing, close contact in some of those sports. So that's really important to keep masking. While the indoor mask mandate still stands for the general public, spectators and audience members, if you're at a play or you're watching a basketball game, still need to be masked. that's still enforceable, still something you need to ask. And then schools can still initiate their own COVID mitigation measures, as Dr. Rubin said. Masking can be part of collective bargaining. I've seen some schools put it as part of their like uniform dress code situation, along with like you have to wear your ID or things like that. So there are ways to get around it, or you can ask a school board to make their own rules. I know that might not be as sound of a way to do it if the school board isn't willing, but there are ways to try to include masking, and there are also ways to just continue to have your own mitigation measures. And I would especially encourage this especially since we have plenty of schools that cater to populations who have special needs, masking to the greatest extent possible is going to be so important in those settings. We've seen time and time again, study after study, that a lot of special needs are associated with risk of more severe disease, even if someone is fully vaccinated. So that's such an important part of that. So there are still things we can do to make it safe. I know that it's really frustrating. I've had a really frustrating week with putting the quarantine order and things together. I do understand feeling fatigue with all this. We'll see what happens with the Supreme Court and how this mask mandate goes again. But in the meantime, just try to be as safe as possible and set up school to be as safe as possible, and we will support you however we can. And there were no submitted questions, so I am going to stop sharing and pull up the chat to see if there's anything that we missed. Okay, I think this is around where I started presenting. Is there a recommended level of student vaccination rate that we should seek to achieve to be considered a positive protective factor within our decision making as we review mitigation layers? That's a good question. There's not any like documented set vaccination rate for what it should be in schools, but if you were to generalize from what we would ask of the general population, it would be around 92 to 95%. It's a lot. Otherwise, you're not going to reach, simplifying this, you're not going to reach herd immunity without being 92 to and upwards. How can you mandate masks if there's no mandate? So it's a strong recommendation. It's true that the enforcement, the chops of the enforcement, what we were allowed to do is kind of in limbo right now, but you can still emphasize the importance of masks. They're effective. I wear a mask even when I'm just dropping off my dog at doggy daycare. We're still in a really high level of transmission. And I think, well, I haven't been around teens in a while, but I think if you ask politely, a lot of people would probably be willing to comply. I know there's a lot of peer pressure situations as well. All right. What if we have a class of students mix of masked and unmasked, and there's a positive case in that classroom? I've seen this come up. This is tricky. If everyone is still sitting 3 feet apart, even with unmasked students, do we need to quarantine up to 6 feet for the unmasked, unvaccinated close contacts and quarantine students 3 feet that are masked and unvaccinated? Unfortunately, Ashley, you are absolutely right. That is what you have to do. I know that's a lot of work. It seems like contact tracing is going to become more complicated, and that schools will have to see which students were not wearing a mask. Yes, this is part of the reason why we want the mask mandate, because it simplifies things. But if someone's not wearing a mask, that changes the risk level of the exposure. It's a very different situation. So the answer is yes, you do have to, take that into consideration. The guidance that we currently have is based on these risk levels, depending on the situation. So you're sitting at least 3 feet apart. That's, going to improve your risk. Everyone's masked. That's going to improve your risk. But if you take those things away, you're increasing your risk level when there's an exposure situation. So I'm not sure that guidance is going to change. That's based on a very set scientific number that determined how far droplets can spread when someone isn't wearing a mask. Can we still make people test for COVID when they have symptoms? Yes, you can exclude them from school if they have COVID-like symptoms. That's pretty standard still. We're still asking for PCR. I don't know about the legality of testing, but I think a lot of people just generally opted into whatever testing program schools have, so you could still just ask them for that. And then the outbreak guidance, where we would require 2 tests per week for 10, until you've gone an incubation period without any new cases. Outbreak testing still stands. Outbreak control is really important, and I believe not a whole lot of outbreak control has been impacted. There was a previous question that wasn't answered. Would the masking be mandatory for? Yes. So for OT, PT, masking is still required. I think there's some clear masks that speech pathologists can use, but that's a more nuanced situation that you can discuss individually if you have an issue. Who is fully vaccinated? And the paragraph about who is not a close contact tested positive in the last. I'm not sure I understand this question, but in the IDPH guidance, there is a table that goes through who is not considered a close contact based on vaccination status and whether they've had an infection in the last 90 days. That still stands. They're not considered close contacts. For classroom with masked and oh, this is an answer. Thank you, Michelle. All right. I think, here we go. Clarification. In the paragraph about who is not a close contact, it states that those who are fully vaccinated and those who tested positive within the past 90 days, but should we still put them on close contact lists so we can monitor them for symptoms and possibly testing in the future? If you have the time to do that, that would be very helpful and very useful. But in order to make your lives easier and expedite the reporting process, this is one way you can cut corners if you don't want to include people who were not considered close contact but had some sort of contact with the case. Can we force close contacts to test if they're symptomatic? As long as they're complying with quarantine or isolation, you can't force them to test. You can ask them to test to return early. You can have that as a requirement. But if it's someone who's symptomatic and they decide they're just going to wait the 10 days, you don't necessarily get a test result. Some people just won't get tested. Vaccinated versus unvaccinated does not enter into the definition of close contact, only masking. Correct. People who are fully vaccinated are not considered close contacts if they've had exposure within 6 feet outside of the classroom, or if it's unmasked, or 3 feet in the classroom. So that's not considered close contact. We wouldn't ask those people to quarantine, but if you would feel comfortable keeping track that they were possibly exposed, then that is fine to add them to the list. We are not requiring that you add those people to the list. I know your job is crazy hard enough, so that is one way to cut corners if you need to. All right. Okay, one more question, because we're at time. My district is asking for the names and vaccination status of students. These are not healthcare personnel. Would giving the students names violate HIPAA? No, as long as you do, I guess it depends who in the district, but if it's district employees or is for district use, it's okay. You just have to give them the names and vaccination status in an encrypted email or a fax, so that that information is protected. But as long as you do it in a protected way, it's okay to share that information within the district and between employees. All right. I think that is it. I'll toss it back to Kelly. If you guys have any more questions, email CCDPH schools, and we'll try to get back to you within 48 hours.
Thank you so much, Lex. Much appreciated. Just as an announcement, Monday is President's Day and CCDPH is closed. Thank you, Jesus. So we get a day off. So if you do not hear back from us, if you send us a question, it may take a few days due to the holiday, but I will try to send out the slides and everything today. I know there was a lot of information and you might want to take use of it before starting the week next week. Thank you all. And if you have any more questions, feel free to reach out to us. Have a great weekend. Thank you.